Good evening. Welcome, everyone. Thank you so much for joining us to observe World AIDS Day 2020. I wish that we could all be together in person, as we've done in years past, but it's more important this year to keep each other safe. So I'm glad you could join us virtually. World AIDS Day is a time to remember those we've lost and to honor those living with HIV. The loss experienced due to the HIV pandemic has been devastating to many of us personally and to all of us as a community. The HIV Alliance has been committed to the mission of preventing new infections and caring for people living with HIV for over 25 years, and many of you have been there with us since the beginning. This year, 2020, has been incredibly difficult. From the unjust murders of people of color, to the rise of a new pandemic, to the frightening wildfires, this year has required us all to be more resilient, to examine ourselves and our organizations, and to recommit to working together creatively for the good of all. The challenges of this year present an even greater burden to the people we serve at HIV Alliance. But with your help and the help of our critical community partners, we can rise to the challenge. Tonight, we'll highlight 3 of those important partners. First, we would like to take a moment of remembrance, and then we'll hear from our keynote speaker, Joelle Goodwin. Now, in the chat box, there's a link to a raffle. If you're feeling lucky, click there and you can buy a raffle ticket for just $2. The raffle includes 2 tickets to Wildlife Safari and 2 bottles of wine from our own Willamette Valley Vineyard. The proceeds of the raffle will go to support prevention and education. We'll announce the winner at the end of the event. If raffle's not your thing, we've included a link to our donation page. Every donation helps. Please consider clicking there to make a donation tonight. Now, I'd like to introduce our President-elect, Mark Molina. Mark has served in the U.S. Army, has been a former pastor, and has 30 years of experience in leadership positions across the community. Mark has recently been elected to the Springfield Utility Board. Mark is going to lead us in a moment of remembrance for those we've lost. Mark?
Thank you, Renee. Good evening, everyone. I'm going to begin by reading a poem entitled My Memory Library by Sarah Blackstone. Imagine if I was given one moment, just a single slice of my past. I could hold it down forever, and that moment would always last. I'd put that moment in a safe within my heart's abode. I could open it when I wanted, and only I would know the code. I could choose a time of laughing, a time of happiness and fun. I could choose a time that tried me through everything I've done. I sat and thought about what moment would always make me smile, one that would always push me to walk that extra mile. If I'm feeling sad and low, if I'm struggling with what to do, I can go and open my little safe and watch my moment through. There are moments I can think of that would lift my spirits every time. The moment when you picked me up when the road was hard to climb. For me to only pick one moment to cherish, save and keep is proving really difficult, and I've gathered up a heap. I've dug deep inside my heart, found the safe and looked inside. There was room for lots of moments. In fact, hundreds if I tried. I'm building my own little library embedded in my heart for all the moments spent with you before you had to part. I can open it up whenever I like, pick a moment and watch it through. My little library acts as a promise. I'll never, ever forget you. Now let's have a moment of silence to remember all those that we have loved and lost from AIDS. I would now like to introduce our keynote speaker for the evening, Joelle Rankins-Goodwin. Joelle is a 1982 graduate of Lincoln High School in Portland, Oregon. She went on to earn a bachelor's degree in communications from the University of Oregon and a master's in psychology from Hood College. Joelle retired from the United States Army after 24 years of service and now works in the Office of Admissions at the University of Oregon. She has served on numerous executive nonprofits boards to include Southtown Rotary, Episcopal Campus Ministries, and HIV Alliance. Joelle is passionate about AIDS, HIV prevention, and patient advocacy. We are honored to have Joelle as our keynote speaker for World AIDS Day 2020.
Thank you, Mark. Good evening. Each year on World AIDS Day, December 1st, we take time to reflect upon our worldwide response to the HIV/AIDS epidemic by remembering the millions we've lost over the past 4 decades. This year, resilience is our theme, honoring our combined work to end HIV, celebrating our collective successes, and remembering those we have lost. We pledge to work in even more inclusive and innovative ways over the coming year. Think about the word resilience, the capacity to recover quickly from difficulties, toughness. Think about that definition. Now think about yourself. I guarantee that word defines you. I never really thought about it until now. It definitely defines me. You see, each and every one of us is here because somehow, some way, we have been touched by this disease we call AIDS. Whether you have been personally affected, a friend, a loved one, I imagine that is why we are all right here, right now. We have to be resilient, right? We pick ourselves up and we keep going. I spent 24 years in the Army, traveling the world. I lived and traveled around Europe, Central America, and of course, the good old United States. I learned, I loved, I matured. But the 2 most defining moments of my young adulthood were the birth of my son in 1995 and the day that my big brother Scott came to visit me in 2000 while I was living in Melbourne, Florida. You see, Scott was a shoe designer living in Bologna, Italy. He came home to the United States often for various fashion shows. But I knew there was something wrong the moment I saw him get off the plane. His body was swollen. His skin was discolored. After forcing him to go to the doctor, we learned that he wasn't just HIV positive, but he had full-blown AIDS and was in complete renal failure. This is where my HIV journey begins, but is far from where it ends. My brother stayed with me in Florida until his death in April of 2000. As I watched my brother deteriorate quickly, I had the chance to learn more about HIV, the virus that causes AIDS, than I ever thought that I would. Up until that point, I really knew nothing. The day that I lost Scotty is the day that my advocacy began. It is the day that my resiliency began, and I didn't even know it. I started learning, researching, volunteering. At this point, I still had 10 plus years left to my time in the Army. With every move, I sought out HIV/AIDS organizations to volunteer my time, give my money and energy to. And that is what brings me to you here today. I moved home to Oregon in 2005 to finish out my Army career. I was working at the University of Oregon's Department of Military Science,
when I stumbled upon a university-sponsored event for World AIDS Day. The university was putting on a condom fashion show, and one of the other sponsors for the event was the HIV Alliance. I don't quite remember how I wound up there, but as it was, I wound up being one of the MCs for the event. I created my own condom fashion. It was a black dress with green and yellow condoms sewn from top to bottom. No, the condoms were not usable, not only due to age, but they had needle holes all through them. But during this event, it was there that I met someone that I referred to as my baby brother, Cree. Cree and I were thrown together as co-MCs for the UO's World AIDS Day condom fashion show. Cree, full of sass and attitude. He'd been diagnosed with HIV only a few years earlier, at the age of 19. Such devastating news for such a young person. But I watched as my friend recovered from learning of his diagnosis and watched as he became one of the most righteous advocates for the cause that I've ever met. Cree is the epitome of resilience. He taught me so much. Like, Scotty didn't have to die. If he had only heeded the signs, being in a high-risk category, being tired all the time, not feeling well, having been sexually active with someone who he found out was HIV positive. But he ignored the signs. It was after this event, after meeting Cree, that I ventured to the offices of the HIV Alliance. The HIV Alliance started servicing Eugene in 1994 and has grown to serve 13 counties for medical case management. The HIV Alliance is resilience personified. I started as a volunteer, answering phones, helping with events, but that didn't last long though, because the next thing I knew, I was on the board of directors. I've watched as the agency earned money through grants and then lost some of that grant money, as personnel had to be laid off. The responsibilities grew, but less money was coming in. As board members, we tried to find new and inventive ways to raise money for the organization. We grew tired and weary, but as a board, we persevered, and so has the HIV Alliance. We are still here. That is resilience. So many things have changed over the years. I watched as my brother attempted to take the literally sickening cocktail of drugs that were supposed to save him, only to watch him throw some 15 to 20 pills back up. Today, an HIV/AIDS patient takes 1, maybe 2 pills to help them survive and live a vibrant life. We're doing better, but the fight is not over. There's still too many people that think AIDS is not their problem. Too many young people that think they are immune, but none of us are immune. We must continue to fight. We must continue to be resilient. Did you know that only 6 in 10 Oregonians have ever been tested for HIV? During my time in the military, I was tested annually. I didn't think twice about getting tested for HIV. 1 in 7 people in the United States are living with HIV, but are unaware of their status. Isn't it ironic how today we are living with a pandemic that some think is no worse than the common cold, yet we find thousands of people are running to get tested for COVID-19. Why is that? The CDC recommends that everyone between the ages of 13 and 64 be tested at least once, and those who engage in high-risk activities get tested every 3 to 6 months. LGBTQ individuals are at higher risk of certain conditions, have less access to health care, and have worse health outcomes. According to the Oregon Health Authority, as of April 2019, 75% of people living with HIV in Oregon were men who have sex with men. As of that same date, 67% of people living with HIV in Lane County were men who have sex with men. 1 in 6 men who have sex with men are unaware that they have HIV. According to the CDC, Black and Latinx men who have sex with men accounted for 66% of new HIV diagnoses in the US in 2017. This despite Black and Latinx people accounting for roughly 30% of the US population. Black men who have sex with men accounted for only 6% of HIV tests, but 36% of new diagnoses. The survival rates related to HIV infection are lowest among Indigenous populations. An estimated 1 in 5 Indigenous people living with HIV in the United States do not know their status. These trends reflect serious systemic issues, including healthcare discrimination and inadequate prevention services, and medical care for LGBTQ communities, especially LGBTQ BIPOC communities. Regular HIV testing and other prevention methods, as well as getting connected and adhering to treatment if you are diagnosed with HIV, is vitally important. Testing is one of our most effective tools for preventing HIV transmission, and all LGBTQ people should know their status. Actually, we all should know our status, no matter what your ethnicity, color, or sexual orientation. Normalizing safer sex conversations and practices within our communities can help reduce HIV and other sexually transmitted infections, and thus help our work to eliminate health disparities. Remember I talked about the condom fashion show? I had my pride and joy there. Sitting in the front row of the auditorium was my then 12-year-old son, Ian. When we can talk freely and openly about safe sex with our kids, when we can erase the stigma associated with HIV, when we can show compassion for those infected and affected, when we are freely able to educate everyone about HIV/AIDS, then perhaps we will be able to eradicate this disease. But until that time, you, me, those who understand, those who have been infected and affected, will have to stand tall, will have to live our resilient lives and continue to fight the good fight.
Thank you so much, Mark and Joelle, for your contributions. World AIDS Day is also a time to revisit the work we've completed for the year and recommit to the mission. This year, we assisted people living with HIV in 13 counties as they faced health crisis, financial strain, wildfires, and more. We expanded our LGBTQ behavioral health program to meet the growing need in that community. And we added syringe exchange sites across the region. Through these programs, we helped hundreds access life-saving health care, emergency housing assistance, food, and warm clothes. In the midst of an increasing drug use epidemic, our overdose prevention efforts led to the reversal of over 500 overdoses this year. I'm proud of the work that we accomplished, and that we includes all of you, all of our volunteers, our board members, and of course, our very important community partners. The first organization we would like to honor tonight has been a part of the Eugene Springfield community since 1976. The mission of the National NAACP is to ensure equal political, educational, social, and economic rights for all persons and to eliminate race-based discrimination. Their mission includes a focus on the right of African Americans and other people of color to have optimal health, to be able to access timely, quality, affordable health care. Our local Eugene Springfield chapter, led by Executive Director Eric Richardson, formed a health committee this year. They stepped up to help families impacted by COVID-19 and wildfires by offering food, information, emergency assistance, and even COVID-19 testing. They have supported access to HIV testing and prevention services, and in the coming year, they will be our partner in an initiative to end HIV in Oregon. Let's hear what those involved with the organization have to say.
Hi there. My name's Andrew, and I'm a care coordinator at HIV Alliance. I've been working closely with the NAACP and Beyond Toxics on the Climate Equity and Resilience Task Force. This is an amazing opportunity to partner with local community resources to determine how best to help the climate vulnerable, the homeless, people with pre-existing condition that often get left out of the conversation. I'm so grateful for the NAACP and the opportunity they've given me to work on such a meaningful issue for both me and my clientele.
Greetings. I'm Mark Harris, NAACP of Lane County Health Committee co-chair. I'm here to talk on the advent of World AIDS Day, December 1st, about the partnership that NAACP has with HIV Alliance. That the HIV pandemic in the United States alone killed 700,000 people. COVID-19, another pandemic, at this writing, it has killed over 250,000 people in the U.S. alone, is on track to surpass HIV if we don't do something about it. The partnership with NAACP, which has been addressing health disparities and civil rights issues, with HIV Alliance, who gives us a community-wide and street-savvy partnership to address health disparities among homeless populations, people of color, and other people who need our help in these distressing times. And we're glad to partner with them at this time. Success in our endeavors.
Greetings on this World AIDS Day. My name is Eric Richardson. I'm the Executive Director of the Eugene Springfield NAACP. It's been good to have a strong relationship with the HIV Alliance here in Lane County. The NAACP understands the long-standing nature of HIV and AIDS and the impact it has had on the Black population worldwide, and the impact that it still has in our communities locally. We understand that the HIV Alliance is an important partner in bringing health and stability and a sense of caring and nurture to our communities. So in 2020, today, I'd just like to thank the HIV Alliance for being a partner with the Eugene Springfield NAACP as we move forward, creating new programming, forging new partnerships, and understanding that with collective work, we can bring about meaningful change.
The next organization we would like to highlight, the Arches Project, has been a lifeline to many in Marion and Polk County. Their mission is to empower people to change their lives and exit poverty. Their vision, which so deeply resonates with me, is that all people should be respected for their infinite worth and be supported to envision and reach a positive and healthy future. Last year, they assisted over 530 families to obtain stable housing. Their resource center helped 1,500 individuals recently incarcerated. Arches has heart and passion for the work, but they also use the latest research, not only to address poverty, but also to prevent poverty. When HIV Alliance set out to start the first ever syringe exchange in Salem, they were the first organization to reach out their hand to us. Let's hear what others have to say about the Arches project.
Hello, my name is Becky Node and I am the Prevention and Education Manager with the HIV Alliance. I'm here to talk to you today about our amazing community partner, the Arches Project, located in Marion County. In November of 2017, the HIV Alliance partnered with the Arches Project to start offering a syringe exchange program for Marion County. We were able to partner with the Arches Project, who provides the spaces that we do our syringe exchange services in. We all know that in March of 2020, social service agencies across the state had to adapt their services and their spaces to meet the challenges of the COVID-19 pandemic. The Arches Project not only adapted their programs, their services, and their space to meet the needs of their clients, but also adapted so that the HIV Alliance could continue to offer their syringe exchange program, which is shown to be an invaluable resource to the community. We are very proud to partner with and collaborate with the Arches Project as we share the same values and commitment to meeting the needs of marginalized populations in the community. Thank you.
Hi, I'm Fallon McCarty. I work as a prevention coordinator with the HIV Alliance. In addition, I also work as a community partner with the Arches organization located here in Salem, Oregon. We've been a part of several community events that have been open to the public, and we are very grateful that we can be a part of that. In addition, Arches has allowed our organization to hold naloxone distribution and a syringe exchange program in their parking lot every Tuesday 1 to 4:30 p.m. When my clients go to Arches, I know that they are met with respect and compassion. They help empower our clients by moving them towards their own personal goals. They offer services that we take for granted, such as having clean laundry, connecting them to medical services and housing assistance. We are very proud that we can be one of their community partners.
Hi, my name is Lindsay Dent. I'm a program manager with the Arches Project, part of Mid-Willamette Valley Community Action Agencies, serving individuals and families in Marion and Polk counties. Resilience can be defined as the capacity to recover quickly from difficulties. The Arches Project and HIV Alliance practice resiliency in many ways that are the same. We have dedicated staff committed to delivering services despite obstacles. We continue the fight to stand up against societal stigmas regarding the misfortunes of those we serve. We understand that innovation and collaboration is key to harm reduction strategies. We adapt our service delivery by considering the implications of COVID-19, as well as the essential functions of carrying out our mission. And even without a global pandemic, we are essential to the health and safety of our communities. Thank you for this Resilience Award, and thanks for the work that you do.
The third organization we'd like to highlight tonight, the Douglas County Public Health Network, is an incredible example of resiliency. Their mission is to improve the health and emergency preparedness of the people of Douglas County. Their small, skilled, and dedicated staff work with community partners of all kinds. They are an incredibly creative and dynamic organization. They truly value community input and provide information that is accurate and timely while also listening to community concerns. They have been side by side with us in our overdose prevention work, and they've helped connect people living with HIV to care and services. They truly live their values of collaboration, engagement, entrepreneurship, availability, responsiveness, and ingenuity. Let's hear a bit more about their work.
Hi, my name is Dane Zana, and I am Prevention and Harm Reduction Manager for Southern Oregon. And I'm here to talk about Douglas Public Health Network and that partnership that we have with them here in Douglas County. They're an amazing group of individuals, and they assist us in safeguarding individuals around HIV and preventing new infections by testing events such as National HIV Testing Day, which we partner with them. Pinpointing other groups to assist with testing, and then the naloxone and fentanyl test strips. We started the fentanyl test strip program here in Douglas County, and that is teaching our clients to test their drugs for fentanyl before they inject them. And then the naloxone piece, not only police trainings, community trainings, and that partnership, I can think of Dr. Bob Dannenhofer, and when he allowed us to buy not only for Douglas County, Josephine County, Curry County, and also Coos County. Any county we didn't have a doctor to provide the naloxone under, he allowed us to use that. That's partnership. And I think Douglas Public Health Network is a true partner in getting our new infections down to zero and preventing overdoses and harm reduction needs. So thank you.
Hello, my name is Kristen Rutledge, and I am the Program Manager for the Douglas Public Health Network. Part of our mission at DPHN is to engage the public and community organizations to improve the health of those who live in Douglas County. Through the partnership with the HIV Alliance, we've been able to provide services and education to a greater number of our community members that we may not have otherwise been able to engage with. By working with the HIV Alliance, we've been better able to understand the barriers and challenges that those living with HIV/AIDS face on a daily basis. We've been able to tailor the work that we do to better serve them, as well as adjust our education and outreach for those who are at risk of contracting HIV/AIDS. Throughout this year, we faced many new challenges with how we serve and reach people. We have shifted from an in-person and personal connections to virtual encounters. I'm personally thankful for the HIV Alliance and their staff that provided feedback and ideas as to how we can best serve people safely while also maintaining that personal connection. We're humbled and honored to be recognized by the HIV Alliance for World AIDS Day. We value the HIV Alliance, their staff, and the continued work that they do. Thank you.
I would like to say thank you to everyone who attended tonight's event. World AIDS Day is a time for us to remember those we have lost, honor those living with HIV, and to celebrate the progress we have made. Our work would not be possible without the support of our community partners. The NAACP, the Arches Project, and Douglas Public Health Network. Before we close, I'd like to announce the winner of our raffle. In the chat box is the name of the winner of our World AIDS Day raffle prize. Congratulations. This individual will be receiving 2 tickets to Wildlife Safari and 2 bottles of Willamette Valley Vineyards wine, courtesy of me. We would also like to thank our sponsors, the Oregon Contemporary Theater for the use of their space, and the West Cascade Peace Corps Association. Thank you for participating, and please consider donating using the link provided to show your support for the HIV Alliance. As one last surprise, the Eugene Gay Men's Chorus has provided us with entertainment to close our event. Please enjoy and stay connected with the HIV Alliance to follow our new developments throughout the upcoming year.
Some days we forget to look around us. Some days we can't see the joy that surrounds us. So caught up inside ourselves, we take when we should give.
So for tonight we pray for what we know can be, and on this day we hope for what we still can't see. It's up to us to be the change, and even though we all can still do more, there's so much to be thankful for. Look beyond ourselves, there's so much sorrow. It's way too late to say I'll cry tomorrow. Each of us must find our truth. It's so long overdue. So for tonight we pray for what we know can be, and every day we hope for what we still can't see. It's up to us to be the change, and even though we all can still do more, there's so much to be thankful for. Even with our differences, there is a place we're all connected. Each of us can find each other's. Each of us can find each other's heart. So for tonight we pray for what we know can be, and on this day we hope for what we still can't see. It's up to us to be the change, and even though this world needs so much more, there's so much to be thankful for. 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 There's so much to be